Thank you so much, ET now for getting us here. And my background is a little bit weird. So I'm a doctor and a scientist with around 20 patents. I'm ex-Philips Research, Intel Labs. So the Apple Watch and the Samsung Watch, what you see is one of my patents. Most of my patents have been products into the MNCs. And one of my deep vision is to convert that knowledge into something, what we can really help for our Indian people. So we have a few more companies also. One is for pediatrics, which is S-Kids. One is for AI-powered diagnostic, which is iScan. And one is a pure AI company called greybrain.ai. You'd be wondering, where all these companies are there. So they are all there in the city where I studied medicine, that is called Berhampur, a tier 4 city, or I would call a town in Orissa. Now, why a town in Orissa is having, for last 8 years, a fertility center? What was the need of it? Was it conceivable? Is it possible? And I would say it became possible because of science. Because I have been a scientist, and then, with my clinical friends, we had this journey that can we really set up IVF practice in a place where there is no supply of it. We have been talking about rising demands of fertility. There is a big need of fertility. There is an urban-rural divide of fertility, the high cost of fertility, not having a AR to build. With all these things, 8 years back, we started a IVF center in a place where IVF was unheard of. Most of these people were going to either Calcutta or Hyderabad or Bangalore. And we conceived this against all odds, where people said, no, this is not going to work in a tier 4 city. IVF is more of a metro kind of a stuff. It requires a lot of skilled people as well as infrastructure. And all these things were actually anti-us. They were away from us. And why we actually believed in science, because, we wanted to create automation as well as we wanted to create the best of the treatment outcome. And that's what, we are going to discuss about this. So our way, why we chose Science for Smile as our vision is most of the technology, whatever is used in IVF, are still imported. It's very unfortunate to see that, we are saying signing India, rising Rath and everything, but still we depend on the technologies which are imported from India. There is nothing wrong of importing technology from India, but when it comes to healthcare, this actually talks about poor outcomes as well as poor specificity. Because these instruments are actually tried on people, either they are European, either they are Japanese, either they are US people, and they are not directly applicable to India. That's why we saw also most of the IVF clinics happening in the metro cities, because it was easier for them to adapt to the westernized countries, but it was almost impossible to build IVF in a very, very rural setting. But if you just see that, where the most of the need is, if 1 out of 4 couples are looking for IVF, then most of the need is actually there in the rural India. But we were actually still staying blind to this because we didn't have really the solution for this. That's where we felt the need. If we developed a research center first, the technology for this first, and created a uniform protocol, can we really make this sustainable? And yes, if I can say after 8 years, we have done that. We grew from 1 center to 4 centers now, and we intend to grow it even further. And one of the big satisfaction what gives me is, because we have done it at a very, very resource-constrained area, and we have done it and we have proven it, it gives us the strength to scale it and sustain it in the longer run. So what is science? If I go back to my scientist hat and then see about it, if you see the Cell Journal or the Science Journal or most of the Nature Journal, we understand human life or biology as this. I call this is my model, I call it the donut model. So each cell is actually affected by the central microbiome. Our entire body, we call it as transcriptomes or the proteomics, what is working, and the outside environment, which is the circadian rhythm and the global warming, what we call it exome. So each of our disease, biomarker, or the diagnostics is actually a representation of either a deranged protein or a aged protein or a broken protein. If you are able to find these proteins, which are D1 to D, innumerable, then you are actually getting a very specific diagnosis. Now, if disease is going to be happening now, diagnostic is going to be happening now, it is going to happen inward to outward. What this means is, if you are able to identify which genetic change is causing what mutation, which is causing what protein change, that is going to be a 100% specific marker for a disease. What we have been doing so far now, we are looking at the size of the blastocyst, we are looking at the morphokinetics of the embryo, then deciding this might be the reason for poor implantation, and that's why we are doing the transfer. So the biology is changing, and AI is helping very big into this. If we really understand the science properly, then definitely, we can do very good, actually, treatment outcomes. So what are the research projects we are taking at Santaan? One of the first one, which is favorite of mine, which we published in 2017 at Metal, Luxembourg, is even minor things like electrical supply, let's say minor things like door vibration, minor things like, let's say, skilled embryologist is not a given in rural India. You don't get actually people, of all those, qualities. And all the discussion has been happening that, why there is a difference in quality between a single IVF chain and a large IVF chain. This is only because, it is very difficult to establish a uniform protocol across your chains. Because somebody was saying, in the IVF that, each clinic is again, run by the individual doctor. That's a challenge. It's very difficult to maintain quality, actually. If each individual clinic is running its own protocol, its own doctor, and the own, let's say, way, they want to run it is very difficult. What we did an IoT plus human factor sensor-based, system, and this is a highly cited journal. What this does is, takes the environmental parameters along with VOC, CO2, N2, and the incubator parameters, plus the working table vibration, plus the door opening and closing rate. So if you know that, if the embryologist is, let's say, less skilled, then the door opening and closing is going to be much more higher, which is going to have a correlation with the environmental changes, which is going to change your outcome of your, rates in the IVF. And we have been using this actually in 2 of our centers, and I can monitor this staying in Bangalore. So our centers are there in Orissa, whereas we can centrally monitor it. But the most important part is we can ensure uniform protocol adherence across our centers. So wherever I will put a new center now, I'm going to install this system. I'm going to train my people onto this so that uniform protocol can be ascertained. Same way, this might be a little bit politically incorrect, but we've been following what has been happening in embryoscope and the development of it. And then, as I told you, the biggest challenge what we see in AI is it is not explainable. So in medicine, what happens is if AI is a black box solution, it doesn't work. AI has to be explainable. It has to be explainable in the terms of the physiological terms. So we are also taking a very ambitious project with IIT Hyderabad. We have been awarded this project over the last 4 years. What we are trying to do is we are leveraging the mobile, camera, which is coming from the mobile phone, the smartphones. I cannot divulge much beyond this because, this is still to be patented. And then we are also using the stock TLS, which is there in the Android and the iPhone systems. Based on this, we are making a biological biomarker-based embryoscope. And we intend to keep it below 1 lakh. This can be a nano kind of a, promise, but we still intend to keep our, mobile-based embryoscope below 1 lakh. If an embryoscope is available more than 1 crore, I think this is not a solution for India. We want every embryoscope, every embryo transfer to be happening in an objective way. It really has to happen. My embryologists and my doctors really need to know which embryo has to be transferred. And if that embryo transfer is based on systems like, let's say, Gary or, let's say, Life Whisperer, which are indirect measures, it is not actually taking the direct measure or the direct biomarker. So this is a very ambitious project of ours. We are still working on it. We have, 2 publications in the, coming time, which will be coming in. And hopefully, I think, if things go well, we would be able to produce first affordable and direct biomarker-based embryoscope in the system. The third and the most important part, a lot of things have been talked about communication, transparency, and trust. Because I worked on behavioral economics, if you see Google, Amazon, Netflix, why they're able to convince you so easily? Because all these systems work on something called as behavioral persuasion or behavioral models. There is a deep science behind it, why somebody, when he says something, why one counselor is effective whereas the other counselor is not effective. There is a science behind it. So we have been working also on this. We have 2 papers on this. Very recently, European Journal has invited us to do a paper on this. What are the behavioral model-based approaches for, counseling. And mostly, this will be out in a month or something. And this is, I think, is a very important part, how to convince people to catch them young so that they are convinced to freeze their eggs, freeze their embryos, so that their chances of conceiving is much more higher in the long run. As well as this brings in affordability in the long run. Similarly, while they're going through the treatment cycle, there is a very bad reputation of IVF clinics. IVF clinics are there to extract money, and they just take the money. They're not concerned with the patient outcome. And this happens because the communication between the provider and the patient is still, at a loggerhead kind of a stuff. So this can be changed. The perception of the IVF clinic would change, and the trust factor will come back again to the IVF centers, provided we have this behavioral model-based patient education. So we are actually having our own proprietary patient-based education, and that's what we are working in. Last but not the least, whenever the woman is actually spending a lot of time in our center, we are the first center who is doing also breast cancer screening and cervical cancer screening for our patients. That we are doing it on a subsidized rate. Why is because, as they are worried, can we use this time to sensitize them? And they are always in the range of, where they should be treated for breast cancer as well as, screened for breast cancer or cervical cancer. We have the AI-based systems, which are non-touch, which are very quick, which can really trial the patient with evidence that, whether they have got the likelihood of breast cancer or not, whether they have got the likelihood of cervical cancer or not. So if you see, we did the innovations or the inventions not only to, let's say, do something looking good on our marketing website, or let's say this was very fundamental for our sustainability itself. So to sum up, I think, I want to stay, sensitive to the time. We didn't invent to just show that, yes, we also have an innovation arm. As we started our clinic, we started also our research and academic division. It's a very, active, functional stuff. And if research and academy, or let's say innovation has to thrive, it has to be pushed from the top, not from the bottom. Not as a separate department, but a very core fundamental part of the department. Because of this, we have lower error rates. We're very proud to say that, we don't have any OHSS. We have every case documented, as well as we have the very easy way to scale it up. Anywhere we have to put a new center now, all our protocols are uniformized, as well as we have the technology to, let's say, scale it from a single center. So that is something, what is very, very important for us. And then that's where, I feel that, when we say science for smile, it is very, very essential for each IVF clinic to bring in this uniformity in treatment so that, our patients are going to smile. Thank you very much.